Welcome to part 3 of our FT10 series. In this session, we'll explore the different modes and settings of the Valleylab FT10 generator. This include monopolar, bipolar, LigaSure, and Cardioblate options. Each one serves a distinct purpose in surgery, from cutting and coagulating tissue to sealing vessels and even performing cardiac ablation. By the end of this video, you'll understand not just what the settings are, but why they matter and how they impact clinical outcomes. We'll keep things clear, simple, and visual. Remember, the FT10 isn't just about power, it's about applying the right energy at the right time for the right tissue effect. Let's start by asking why these modes matter in the first place and how they can make the difference between routine surgery and excellence in outcomes. Before we get technical, let's step back and ask, why do these modes even matter? The FT10 is not a one-size-fits-all tool. Surgery involves many tissue types: thin, thick, vascular, or delicate. Each mode tailors energy delivery for the right balance of precision, hemostasis, and safety. Think of it like switching gears in a car. You wouldn't climb a steep hill in the same gear you cruise a highway. The FT10 gives surgeons the flexibility to switch energy gears mid-procedure, optimizing both patient safety and surgical efficiency. These settings aren't just convenient, they're crucial. In fact, selecting the right mode often determines how well the tissue heals, how much blood loss occurs, and even the speed of recovery. That's why it's worth breaking them down one by one. Monopolar is the most common mode group in electrosurgery, and the FT10 provides multiple options. These include pure cut, blend, Valleylab, soft, coag, fulgurate, and spray modes. Each waveform manipulates tissue differently, whether creating a clean incision, blending cut with coagulation, or producing surface hemostasis. Monopolar requires patient return electrode, meaning current travels from the handpiece through the patient to the dispersive pad. This setup allows broad application from open surgery to laparoscopy, but it also demands vigilance. Poor pad placement can cause burns, and inappropriate settings can lead to excessive charring. That's why understanding each submode is critical. In the next slide, we'll zoom into the details of cut and coag, since those are the backbone of monopolar work. Now let's zoom into the monopolar cut and coag options. Pure cut delivers a smooth incision with minimal coagulation. This is ideal when precision matters most. Blend mixes cutting and coagulation for controlled dissection with reduced bleeding. Valleylab mode adapts to surgeon speed. Slower movement gives more hemostasis. Faster movement gives cleaner dissection. For coagulation, soft creates deeper desiccation, often with a ball electrode and saline drip. Fulgurate produces surface coagulation via sparks, which is effective but less precise. Spray distributes energy more diffusely across tissue surfaces, helpful for broad hemostasis. Each one is like a different brushstroke in a painting. The surgeon chooses the right effect depending on the clinical canvas. Getting these settings right minimizes complications and improves overall surgical flow. Now let's look at bipolar modes. Unlike monopolar, bipolar energy flows only between the two tips of the instrument. No return pad is needed. This makes it safer in delicate regions and for patients with implanted devices. The FT10 offers precise, standard, and macro bipolar settings. Each one balances power and voltage for specific needs. Auto bipolar sensing is also available. automatically starting and stopping energy delivery based on tissue impedance. That means less chance of user error and consistent performance across cases. Surgeons appreciate bipolar because it reduces lateral thermal spread and keeps energy tightly focused. But just like the monopolar, understanding the differences between the modes helps tailor the energy to the surgical goal. Breaking down the bipolar modes. Precise is for fine, low voltage coagulation, minimizing sparking and thermal spread. Standard is the go-to for most bipolar work, delivering steady power across a range of tissue resistances. Macro ramps up voltage and power, suitable for cutting or rapid coagulation when speed is critical. Auto bipolar adds convenience. It senses tissue impedance under 2200 ohms and activates automatically, then stops when impedance rises above 4000 ohms. Together, these options give the surgeon versatility, from delicate neuro work to high-speed vascular control. But it's worth noting, with higher energy levels, there's always increased risk of collateral damage. So part of mastery is not just knowing what a mode does, but when it should be avoided. LigaSure technology deserves its own spotlight. This advanced bipolar system seals vessels up to 7 millimeters in diameter and tissue bundles. The FT10 delivers controlled RF energy plus mechanical pressure throughout specialized instruments. The result? Permanent vessel fusion with minimal thermal spread and almost no sticking or charring. LigaSure is widely used in laparoscopic and open surgery because it speeds up procedures and improves consistency of seals. The system automatically adjusts energy delivery to tissue impedance, so the seal is reliable without guesswork. It's not just about stopping bleeding, it's about doing so in a way that reduces rebleeding, shortens operative time, and improves surgical confidence. LigaSure has become one of the hallmarks of modern electrosurgery, for good reason. The Cardioblate system brings RF ablation capability to the FT10 platform. It's used in cardiac surgery to create lesions that help treat arrhythmias, such as atrial fibrillation. The system supports both monopolar and bipolar instruments, but only with Medtronic approved accessories. In monopolar mode, power is limited to 50 watts, while bipolar ablation adapts automatically. Contraindications include use in active endocarditis or ablating in a pool of blood. Safety is paramount here, as ablation must be precise and consistent. The FT10 integrates safeguards like REM monitoring and strict compatibility requirements. Cardioblate highlights how electrosurgery isn't limited to cutting and coagulation. It extends to reshaping tissue conductivity in life-saving cardiac procedures. Tips for safe operation. Always use the lowest power that achieves the surgical effect. Confirm patient return electrode placement in monopolar cases. Inspect all instruments and cords for damage before use. Avoid activating devices near flammable anesthetics or oxygen-rich fields. Be cautious of capacitive coupling in laparoscopic setups, and monitor closely when patients have implanted devices. Use compatible accessories only, since the FT10 is designed with specific impedance and safety ranges. Another overlooked detail, ensure the foot switch or hand activation matches the surgeon's preference to avoid errors under pressure. By combining technical knowledge with safe practice, surgical teams maximize patient safety while also protecting the integrity of their equipment. We have now covered the full range of FT10 modes: monopolar, bipolar, LigaSure, and Cardioblate. Each one addresses a unique surgical challenge, from clean incisions to cardiac ablations. The unifying theme is precision and adaptability. The FT10 tailors energy delivery to tissue needs while maintaining safety. It's about control, timing, and matching the tool to the tissue. The FT10 is powerful, but its strength lies in the way it's managed. Thanks for following along, and let's continue building our expertise in the FT10 step by step in this series.